Compassionate Journeys, Conversations about Home Care and Hospice. Today we're speaking with Naomi Prendergast, President and CEO of Duville Life and Wellness Community and Vice Chair of the Board of Trustees of Lowell General Hospital and a fellow Wellness Health System partner. Naomi is also a former Home Health Foundation Board of Trustees member and a past honoree of our Legacy of Leading event. Welcome, Naomi.
Thanks so much. It's great to be here.
Thank you. So I know Duville has been a long-term community partner of Home Health Foundation, and I'd love it if you wouldn't mind telling us about its services for anybody who's not familiar with them already.
Absolutely. And in fact, even for folks who might be familiar with our services, they've grown and evolved over time. So
True.
It's always really good to make sure people are aware of what we currently do.
Yeah, thank you.
Sure. Duville has been in Lowell since 1960, quite a long time. We have a beautiful 75-acre campus, about a mile and a half down the road from Lowell General Hospital on Varnum Avenue. We have 2 skilled nursing facilities. One, Duville Senior Care, is one of the largest skilled nursing facilities in the entire state at 208 beds. And that includes 84 beds of special care dementia. We really focus a lot on people who have Alzheimer's and other dementias. But we also do a lot of short stay rehab for people who have had illnesses or accidents and need some rehab before going home. And so between Duville Senior Care and our Duville Center for Advanced Therapy, which is a short stay building only for short stay, we actually send about 100 people a month back into the community who have come to us for short stay. We also have the Saab residence on our campus, which is an assisted living with 60 apartments. And one thing that's different from other assisted livings is that we also welcome people of low and moderate income who can't afford to pay market rate.
That's important.
It's very important because there isn't any public funding for assisted living in Massachusetts. We also have affordable independent apartments for seniors age 62 plus. So we have a full continuum of care on our campus, and we also actually have 2 tenants on our campus. Fallon Health has their Summit Elder Care PACE program, and also Encompass Health has a 22-bed acute rehab. So those tenants are on our campus as great partners, but they are licensed and owned separately from Duville. So we're a very busy campus.
Sounds it. You mentioned that there's been a lot of growth, even for people who are familiar with Duville. What have you seen most recently?
Well, most recent was the addition of our assisted living, which was 5.5, 6 years ago. We opened that. But when people think of Duville, they really think about just the nursing home very often.
Okay.
And it really has been in the last 10 to 15 years that we have evolved into a full continuum of care.
Yes, actually, I'd love to talk more about that as well, because I know a lot of people are familiar too with the concept of retirement community that continues with you as you age in place. I'd love for you to talk more about the distinction.
Sure, absolutely. A lot of people think of continuing care retirement communities, or CCRCs.
Thank you.
And typically a CCRC is an organization that offers all these different levels of care, as I just mentioned, that we do at Duville, but there's a price that one pays for entering the system.
Yes.
And that's going to vary somewhat according to the organization, but there really is an upfront investment that has to be made. Where at Duville, we are totally a la carte. So we have all these services on our wonderful campus, but every piece is paid for depending on what level of care it is. So for example, at our skilled nursing facility, it's either going to be paid for by insurance, which could be Medicaid, or it could be private long-term care insurance, Medicare for a very short period of time, or self-pay. At our independent living, it's also self-pay, but that's for low income. But there isn't an upfront cost, so it is all month to month or day to day, depending on which level of care.
And people could maybe choose what they need as people's needs change, and they're not maybe tied into one service or another.
Absolutely. And we see that all the time. People's
Sure.
needs change over time. But what we really try to do is when somebody is already living on our campus, we consider them family. And we want to make sure that to the extent that we can, that we keep them on the campus when their needs change.
Yeah.
So sometimes that means somebody is in our assisted living, but really needs more intensive care, such as you need at a nursing home level. And so we have both of those organizations on our campus working together to try to make sure that there's a great and easy transition.
Yeah. And Duville is a nonprofit, as is Home Health Foundation. And I know that our missions are deeply rooted in that philosophy. Would you mind talking a little bit about what difference it might make to be a nonprofit?
Sure, absolutely. And in fact, Duville is a faith-based nonprofit.
Yes.
We're a Catholic healthcare organization, which absolutely does not mean that everybody on our campus is Catholic or Christian.
Yeah.
But what it does mean is that we embrace those values and the values of compassion and respect, which I think anybody would agree that if you're going to be providing elder care and health care, those are great values to embrace.
I think the whole world can use more of that actually right now.
I think you're probably right, Cindy. But as a nonprofit, we keep coming back to our mission, and our mission is of compassionate care. We're founded by the Sisters of Charity of Ottawa. We're now sponsored by the Carmelite Sisters for the aged and the infirm.
Okay.
But the mission is front and center.
Yeah.
All of our staff can articulate why we exist. So as a nonprofit, and just like the Home Health Foundation, your roots may be different than ours, but it's also very mission focused. And so what I think is so important about a nonprofit, and especially obtaining your health care with a nonprofit, is that what drives us is to serve and to make sure that we're providing care only for the right reasons without getting distracted by perhaps the interests of shareholders.
Absolutely. I know that compassion is a word that our patients, especially here, again and again and again, it's something that we hold very dear. Do you find that when you employ, and I know that Duville is a massive employer in the Lowell area, and you might want to talk about that as well, but do you find that you that's a niche that you go after, that you draw a certain type of caregiver because of your mission and your focus?
I like to think so, yes. When we have new employees join Duville, we have, of course, an orientation process.
Yeah.
And part of my job as the CEO is to welcome the new employees. And so I go to the beginning of every orientation.
I would love that.
And just, to just introduce myself, find out who the people are in the room. But one thing I say, because I talk a little bit about our mission, but I say that when we talk about compassion, it's not just about how we treat people we care for, it's how we treat each other.
Yes. Oh, that's key.
And I make a point of saying not every day is perfect at Duville. We're people taking care of people, right? And life throws curveballs.
Yeah.
The difference,
Every
though,
day.
is every day. That's right. In fact, it's really a case of, well, what will it be today?
Absolutely.
But how we treat each other is really important. And we really want to make sure that we're working together and respecting what somebody else might be experiencing. We have lots of working parents. We have lots of single parents as employees. Especially these days, it's not easy. It used to be you send your child to school, right?
Yeah.
Well, what does that mean today?
Yeah.
It's
used to not think about it.
Exactly, right. So the compassion is really important to us in terms of everyday experience. And we actively work on trying to make sure that it's really felt at all levels. But you're right, we're a very large employer. We have close to 500 employees, and we're one of the larger.
It's massive.
We have a lot of people. And what's great is that we're really a melting pot because we have staff from all different backgrounds, many recent immigrants, people from so many different cultures. We have entry-level staff, we have staff with advanced degrees, and we all work very well together as a team. But again, actively looking to make sure that we all honor and respect the gifts that we each bring to the workplace.
Sounds like you really reflect the patient population as well.
We do. And, Lowell, as we know, it's an old mill town with, there's a lot of diversity within the city. And it's very important that we be there as a provider to reflect that. And, of course, Home Health Foundation is very active within the Lowell community as well.
Yes.
So I'm sure you see that, too.
Yeah, we really pride ourselves on that, too. And I know you and I had spoken at one point, and you had told me some pretty inspiring stories about the longevity of employees and how they, in some cases, grew to other positions.
Yes, and I'm actually in my 18th year there at Duville, so I've seen a lot of this.
You've seen it all.
I've seen a lot, but yes, we have some employees, who started in one position, moved to another. Actually, in my own orientation class, there was a certified nursing assistant. It was her first day there as well. There were 6 of us in the room.
Yeah.
She and I are still there, but she is now a licensed nurse. We have one of our lead chefs started many years ago in housekeeping, but gained a whole other set of skills, and his cooking is just awesome. We've had several employees who over the years have just been able to grow their careers. But we have lots of staff who have been with us over 20 years, some over 25 years, 30 years. In the fall every year, we have a celebration of our service milestones. And it's just always great when we have people who have been with us 25, 30, 35, even 40 years. It's just truly amazing.
Well, they probably feel supported and that they can grow.
Right, they can grow, and it's family, but as our campus has grown, it also gives people additional opportunities, because maybe somebody wants to step back from a very intensive nursing career and to do something that is more of a wellness focus, and we have those opportunities because of the continuum of care on our campus.
Yeah. One thing that I hadn't asked you about is there any opportunity for volunteers or donor support?
Oh, absolutely. And both.
Okay.
Yes. So first the volunteers.
Yeah.
And of course right now there are so many COVID restrictions. We do have a handful of volunteers who are back. But yes, absolutely. We have volunteers who help us with so many things. Some of them are some of the fun activities. We have people who help with transport, so helping residents get from their living area down to the beauty salon, for example.
Oh, that's nice.
We have people who are Eucharistic ministers coming in. There's a volunteer opportunity for just about what anybody might be interested in. Our volunteer coordinator is Debbie Shanti, who is our mission director, actually. And for donor, we actually have our own foundation, the Duville Foundation, which raises money every year for things that are needed on the campus, because, of course, where most of our revenue coming in is public funding, Medicare, Medicaid.
Absolutely.
And there's just not a whole lot of wiggle room for what we call the niceties, not just the necessities. Yes. So
I like that word, nice.
Well, it's important to have the little extra, especially on our campuses where people live, and we want to make sure that people have what's going to really enhance their quality of life. So the Duville Foundation raises money every year. We, of course, over the last year and a half, we haven't really been having our special events, but we do have one coming up on October 19th. We typically have 2 golf tournaments a year. We have the area's only ladies golf tournament, and then we have what we call our golf classic. Well, this year we're combining the 2. It's going to be on October 19th at Indian Ridge Country Club.
Oh, that's beautiful.
It is beautiful, and hopefully it's going to be a gorgeous, gorgeous day.
Yeah.
That's a little bit out of it. We deserve it. It's out of our control, but we do deserve it. Thank you very much. But yes, so we raise money that way. We have a lot of really great donors and area supporters, and we have for quite a long time.
What is on your list of niceties? What's on your wish list?
Well, most recently we've been focusing on technology, because what the pandemic really showed us is that we need to have adequate numbers of devices so that our residents can connect with families when visits
yes.
are not able, right?
Yes.
And also, we need to be able to live stream activities from common space to resident rooms. If certain people, like if we're not able to have different residential neighborhoods, as we would call them, mix with others. So that's really been our focus. And we actually have recently applied for a couple different grants that have been funded to put money towards this.
Yeah.
So that's what really has emerged for us. Past projects involved a bus, a 14-passenger bus, so we can have our residents go out into the community.
Wonderful.
We took 2 years to build the Duville Park, which is on our front grounds.
Yes.
And
That's lovely,
it's a senior-friendly park. We welcome the neighborhood as well. We've done a lot of different projects, but the current focus really is on the technology and keeping people connected even when circumstances don't allow them to stay connected in the more typical ways.
Yes. I have found, and that's one thing that's come up with Home Health Foundation again and again, is even when the pandemic passes or this pause when things seem to be getting much better, that even when people were able to get back to being with one another, sometimes circumstances still prevent it. And so to have the technology, to be able to zoom into an event or to be able to zoom into a physician appointment just makes a lot of sense and is much more convenient even when things are okay.
Absolutely. The doors have been opened.
I agree.
And
That's the one single positive.
Correct. I mean, so many people have children who live in other states.
Yeah.
And now it's become so easy to have a face-to-face visit virtually.
Yeah.
Yeah. Yeah.
Oh, I like that a lot. And there's been enormous publicity, speaking of COVID, about the rates of infection in Massachusetts nursing homes and other facilities. But I know that Duville has been, taking positive, proactive steps all along. Would you like to talk about some of those steps with vaccination and such?
Sure, absolutely. And we have a fabulous clinical team at Duville with just very strong leadership. I'm very proud at how we masked before we were told that we had to. And our infection rate was much less than many places, I think because of that. Also because of the space we have and the state-of-the-art air exchange program, for example, I think that all really helped quite a bit. So as of right now, we are about 85% vaccinated.
It's very high.
Which it is high.
It's not even mandated right now.
Well, no, it actually, the word of the mandate came out about a week or so ago. But yes, by October 10th, it is mandated that all of our staff must be fully vaccinated unless they can qualify for either religious or healthcare exemption, which are not going to be easy because there's going to have to be documentation either of a sincerely held religious belief or that the personal physician has said that this individual really should not be vaccinated, and there are very few people who are really in that situation. So we treat, even though that mandate is only for nursing homes, it likely is going to be happening for assisted livings, but honestly, as a campus, we hold every entity to the same standard, and I think that's also why we really have been a very safe environment throughout the last year.
Yes.
So we're just so glad that we have a high vaccination rate, but it's only going to get higher.
Yeah, absolutely. And people who aren't able to get vaccinated for whatever reason, they'll still wear face coverings and they'll be kept safe that way.
And actually, all of us still have to wear face coverings, right, regardless of vaccination status.
Yeah. Well, this has been another great discussion. Thank you very much for your time, Naomi.
Oh, absolutely. It's just a real pleasure, and appreciate all the great work of the Home Health Foundation. It really is a wonderful organization. Our community is much better off because of the presence.
Well, we're great partners, and I'm sure we will be for many years to come.
Absolutely. Thank you.
So to learn more about Duville, Life and Wellness Community, visit duville.org. And as always, visit homehealthfoundation.org longtime.org for more information about home health and hospice care wherever patients call home. And thank you, and see you next time.